getting the book, Ancient Secrets of a Master Healer, a Western Skeptic and Eastern Master on Life's Greatest Secrets. So I just read the blurb, and I'm going to share the little blurb with you, which kind of caught my attention. It says, join a skeptical university researcher from the USA as he travels to the Himalayas and uncovers secrets from an ancient healing lineage that began with Lord Buddha's physician. For thousands of years, the greatest healers in the Himalayas have been refining a potent healing science for the treatment of physical ailments, psychological disorders, and spiritual challenges. The most effective natural healing methods were recorded on ancient scrolls. Now, in this breakthrough real-life account, many of these healing secrets are revealed by the author's encounters with the legendary master healer, Dr. Naram. So, whatever it was about the energy or the spirit in that blurb, it caught my attention and I decided to get this book. So I did. This is what grabbed me. This is why I kind of gravitate to books on health and holistic approaches to health and healing. One reason probably is many years ago when I was in my 20s, I struggled with what we call in Great Britain and in Ireland, ME, which stands for myalgic encephalomyelitis. The layperson's term, I think, is chronic fatigue syndrome, but I'm not sure that's an accurate understanding of the condition. So I struggled with that for many years. It starts with a viral infection. You don't get over the infection fully. You're in post-viral debility. And then eventually a doctor diagnosed me with ME, which is the prognosis is it could go on for many years. And it's a very, very debilitating condition. So I struggled with that for a good 7 years before I was at the point where I could resume studies or whatever I was doing at the time. And it's remained residually in my body for the rest of my life up to this present moment, but I'm well on top of it and know how to pace my life accordingly. So, because conventional medicines didn't really get to the root cause or really come up with an effective treatment for this condition, I've always been interested in more integrated holistic medicine. So, you know, and I have benefited tremendously from conventional, you know, medical treatments over the years. There's no doubt about that. And I've, like everybody here, I've taken my fair share of pharmaceutical, you know, drugs and so on, and they've helped to treat certain conditions. But I've always remained open about and curious about ancient healing modalities from the East, and why in thousands of documented cases, they seem to work, but they work without pharmaceutical or surgical intervention. So I'm also interested, you know, in energy healing and the way you can work with various vibrational frequencies that emanate from every organ and every cell in your body. Now we're in the midst of a worldwide viral pandemic crisis. So leaving those global catastrophes aside, it seems to me that most illnesses people, particularly here in the Western world, experience, such as heart disease, arthritis, cancer, neurological and emotional disorders, are not unrelated to the toxicities we absorb from the environment in which we live. And they're not unrelated to negative and defeatist thought patterns we have adopted since our childhood, and the many emotional blockages we form along the way as, you know, we're kicked around by life and by others. That's my take on it. So in my opinion, these are what underpin practically all illnesses and pathologies that our multi-billion-dollar, you know, medical and pharmaceutical industries attempt at best to manage, but never fully understand or address the root causes. So that's what drew me to reading a little more and studying a little more around a more expansive, holistic approach to health and to healing. Okay, So the author of this book, Dr. Clint G. Rogers, is not an MD. In fact, he is, let me see, he has a PhD in educational technology. So in 2009, he was working as a postdoctoral research professor at a university in Finland, working on projects to help promote educational opportunities for places in the world where there's a lot of poverty and inequality. So that's his area of expertise. At the time, he was a member of an international volunteer group. And I think their work at the time was trying to work with people who suffered from clinical depression, particularly those who were struggling with suicidal ideation and so on. And his own sister at a very young age took her life in her teens, having struggled with clinical depression. So he was sent back to California. He's from Utah in the United States. So he went back to California to a fancy hotel where his job was to meet up with celebrities that had been selected to be interviewed by him on video to talk about their experience of clinical depression, or how they possibly found treatment, or what their views are on depression and so on. But when he met the organizer of the event in this hotel in California in 2009, and she listened to his story and what he was looking for, she suggested that he meet a different person. She said, well, I think you need to meet Dr. Naram. And he's an Indian doctor. And he happened to be in the hotel that day running a clinic. So she explained he's a holistic doctor. He practices kind of Ayurvedic medicine, and he's treated all kinds of illnesses and disorders, including suicide, depression, or people in all kinds of emotional difficulties, as well as physical problems. So sure enough, he decided to take her at her word and went to interview Dr. Naram. So this is where this whole journey and story began. So now at that time, around 2009, 2010, Dr. Naram was virtually unheard of in the United States. But he was very well known in Asia, India, and a few other countries, Africa, I believe, and some parts of Asia. There were over 1 million people who had attended his clinics there, but not in the US. So just a little bit about him. He studied for a number of years at various universities in India. He's from Mumbai in India, but he studied Ayurvedic medicine for a number of years and graduated as an Ayurvedic doctor from whatever university in India, and started practicing Ayurvedic medicine for a few years. But he wasn't getting the results he thought he would get. Also, he was struggling with some personal issues. He was quite overweight. He was slipping into some form of depression himself. So he wasn't feeling fulfilled in his medical practice. So at that point, he somehow found himself in the Himalayas and met up with this particular practitioner who was part of this ancient lineage dating right back to the Buddha's physician, who practiced a form of medicine they called Siddha Vida, which seems to be an extension of Ayurvedic medicine and is a little more involved and more detailed. And the only way you could become a practitioner of this is not to go to school. You have to serve an apprenticeship with one of these healing masters. And that's a very difficult and challenging opportunity to find. But Dr. Naram did find this particular practitioner who was part of this lineage, and he ended up spending like a 2-year apprenticeship, learning everything he could from this master healer. He particularly learned how to diagnose a person's condition and practically everything about their overall health and well-being from reading the signals in their pulse. It's kind of called pulse diagnoses. So in Siddha Vida medicine, there are 3 pulse measurements, what they call Pitta, which is the fire, dosha, Vata, V-A-T-A, which is the wind, dusha, and thirdly, Kapha, K-A-P-H-A, which is the water, earth, dusha, energies in the body. So they can detect these three pulse measurements. And based on the strength, the pattern, and the speed of the pulse in each point indicates any potential imbalances and blocks in their system. And those blocks correlate to physical, emotional, and or mental problems the person is either facing or will likely face in the future. So that's a key part of his training, becoming a master pulse diagnostician. Now, when he got going in his practice and really well established, Dr. Naram would see about 300 people a day at his clinic in Mumbai, India. Yeah, you'd wonder, well, how does someone see 300 people a day and do a proper diagnosis of whatever they might have? Well, he would spend an average of 6 minutes with everyone who came to him, and they travel from everywhere. And he would give them what turned out to be a very accurate diagnosis of their physical and emotional states of health. Now, he treated them in a number of ways. He pressed on different parts of the body, what he calls marmaya points. If any of you, like me, have had acupuncture or kinesiology or some other complementary medical treatments, you're probably familiar with what are called acupressure points around the body, or meridian points. So I think my interpretation of what Dr. Naram was doing is he was definitely pushing on pressure on different parts of the body. He called them marmaya points. Maybe they're somewhat different to acupressure points. I don't know. But that was part of his practice in detecting and diagnosing what was going on, as well as the pulse reading. And based on that, he would basically give them a breakdown of what was going on and also put them on a course of herbal remedies, which he had formulated himself. And these herbal remedies were produced at a state-of-the-art facility somewhere in Mumbai, where they harvested everything they needed to put into the herbal remedies and medicines, correlating with lunar cycles and with certain times of the day and night. And he was very strict about how that was done. So that's generally what he would do in a clinic. When he came to the United States, he would see maybe 200 people a day. But again, on average, seeing everyone for about 6 minutes per person. But his clinics went till about 2 o'clock in the morning. He'd start around 10 a.m. and he'd work till about 2 o'clock the following morning, filled with the same enthusiasm, apparently, and energy that he started with. Okay, let's see. Okay, over the span of his life, as he got well known, he ended up treating people like Mother Teresa of Calcutta. He treated the Dalai Lama. He treated Nelson Mandela. He treated many famous sports stars and celebrities and billionaire entrepreneurs here in the United States. He also treated a lot of firefighters and volunteers who were involved in, after the 9/11 attack, who continued to work through the rubble and, at ground zero for many months after that attack. Even with whatever, ventilation system they were working with, a lot of them inhaled very, very toxic chemicals and fumes, for which some of them developed chronic serious lung conditions, and a lot of medical treatments didn't work or help them. So he ended up doing a clinic in New York, seeing thousands of these firefighters and volunteers, doing his usual system of diagnosing them, providing particular herbal remedies and medicines. And sure enough, they all seemed to respond very positively to his treatment when they had already tried everything else conventionally. And he was given many awards. One was for that work that he had done with the firefighters, but in other parts of the world as well for his work. So how did Dr. Clint get intrigued by this Dr. Naram? So he's a research educational psychologist, And he's very skeptical about what he's seen at this hotel at that particular day in Los Angeles. He's intrigued, but he's also highly skeptical, even though he interviews him and gets a good sense of him. So let me just quote what he says in the early part of the book after kind of meeting and assessing what Dr. Naram was doing. So he said, when I met Dr. Naram, I was intensely skeptical. How was it possible to do what I was told he could do? Before the events described in these pages, my attitude about health was what might be labeled as typically American. I consumed a lot of processed and fast food, and whenever I became ill, I would either search Google to find out what I could do or go to a doctor. For diagnosis of my problem, I expected the doctors to use a thermometer to measure my temperature, poke me with sterile needles to suck blood from my body, and in some cases, zap me with electromagnetic radiation or ask me to pee into a small cup. Based on the results, I expected a prescription of a pill or shot to make me better, or in extreme cases, surgery. I assumed they would give me whatever was the best solution according to the latest research. This being the case, I couldn't make sense of how Dr. Naram could so accurately diagnose and effectively help people with what he calls the 6 secret keys of deeper healing. So Clint Rogers was so intrigued and taken by what he was witnessing, he decided to go to India, to go to Dr. Naram's clinic, to interview thousands of people who came for treatment and to video record them and to document everything he saw. So this is what happened. And he actually ended up spending about 10 years working with and following and documenting everything Dr. Naram did for about 10 years. But the book that he just published, this is the second edition, only covers the first year that he spent traveling the world with Dr. Naram. Now, he still remained, in the early stages, very skeptical. He was wondering, well, is this all just a placebo effect? Or is there another way that this is all just fabricated? And that's what propelled him to keep looking deeper and deeper into what he was seeing and witnessing in it and questioning it. And then later on, he calls in some, conventional medical professors from around the world to get their take on what they understood by what they prefer to call complementary medicine, not alternative medicine, because this kind of medicine has been around for thousands of years, whereas allopathic medicine has only been around for a couple of hundred years. So that's why his practitioners prefer to call it complementary medicine, not alternative. Okay, so let me do this. Let me share with you 4 examples from the book. These are just examples of people that met with Dr. Naram. He treated them and they got better. So I'm just going to share 4 examples. There are many, many others in the book, but I'll just share these 4 that sort of came to mind and struck me. And the first one is actually, I think, from the first chapter in the book. So this is a young girl. I think she was only 13 or 14. Reshma is her name. And she lived with her family in Bangladesh. So they had known about Dr. Naram, and I think her mother used to watch. He had a TV show from Mumbai, and he'd do his clinics, and it was televised. So she was following actually Dr. Naram and knew about him and his work, and was taking some of his formulas at home. But her daughter developed a life-threatening blood cancer condition. So they needed to go to India. So they traveled 1,000 miles to a top cancer hospital in Mumbai, India, for their daughter to be treated with this rare blood cancer condition. And they treated her, and she was under the care of a world-renowned specialist in this particular area of cancer treatment. But there were complications from the blood cancer treatment, which left her in a deep critical coma, out of which her doctors did not expect her to ever come around. I mean, they explained to her mother they had treated other cases similar to hers, but she was in such a deep coma as a result of whatever complications had set in. They expected zero chance of her coming out of that. So she was in ICU, in this, all hooked up to ventilators and everything going on, but with only just to placate her mother, in other words. They basically said to her mother, we'll give you time if you need a few days to come to terms with this, but no one in our medical experience or history has come out of the type of deep coma that she is in. So we just want you to find your peace with that and make that decision to take her off the ventilator. So her mother remembered she's in Mumbai, and this is where Dr. Naram has his clinic. She just said, you know what, I'm just going to give this a shot. I'm just going to go find him if he's there and see if there's anything conceivably possible that he can do to save her young daughter. So she found out where he was. He was actually, they were recording a TV show of his work. So she got into a taxi, goes to the place where they're recording the TV show, walked right into the studio while they're recording the show. And she's like crying and just in this place of deep anguish. And she's just approaching him and he's up on the stage area doing whatever. Now they're recording the show. So he asked his cameraman to stop recording. It wasn't a live recording. So he came to her. He listened to her patiently and she explained their situation, that she was at her wit's end and did not want her daughter to die. Was there anything he could do to help her? So he said, well, this is what I'll do. I can't go personally. I'm leaving in a couple of hours to go to some other part of the world for a clinic or something like that. But I'm going to send Dr. Giovanni. Dr. Giovanni was like, if you do read this book, he's kind of like Dr. Naram's sidekick doctor. Now, he's Italian, and he trained as a medical doctor at the oldest, I think, and most prestigious medical university in Europe, which is in Bologna, Italy, and practiced as a medical doctor for many years, but also got frustrated with, treatments and diagnoses and not getting very far with certain people. So somehow he met up with Dr. Naram and they started working together. So he spent 17 years training with Dr. Naram. So he knew how to treat people in using Siddha Veda medicine. So he went with the daughter's mom to the hospital, to the IC unit where her daughter was all hooked up and, on her last legs, basically. So he did the pulse diagnosis first, and then he consulted with Dr. Naram and they talked over a few things. So basically he did a number of things. He certainly worked on different, what they call mamaya points around her body, quite extensively. Then he put together some kind of an herbal paste. He got ghee, the clarified butter, which is considered sacred in India, and he mixed in some other herbal remedies that Dr. Naram had prescribed into sort of a paste. Now, this all sounds bizarre, even primitive, and he applied that to her navel in her lower stomach, so that was the only way they could feed her any nourishment because she was so debilitated. So they put this ghee with the herbal remedies on her navel. And the third thing he did, which is also a little bizarre to us Westerners, he asked for a sliced onion and a bowl of milk. So they put the sliced onion on one side of her bed and the bowl of milk on the other. And shortly after they did that, her eyes started streaming, responding to the acidity of the onion. And then he just trained the mother what to do with the mamaya points around her body and how to do this so many times a day after he left. And so he left. And about 2 days later, the mother called the clinic, Dr. Naram's clinic, spoke to Dr. Giovanni to say that, with very exhilarated, their daughter was now 50% less relying on the ventilator and was showing signs of recovering. And one day after that, she called up ecstatic. Her daughter was 100% out of this coma, fully energized and coherent, and had made what appeared to be a remarkable recovery. So much so that the nurses in the ICU had 4 other patients in deep comas. They decided to apply Dr. Naram's methodology, and they did. And within days, 3 of those patients in deep comas came out of their comas. The 4th one didn't fully come out at that point. Okay, that's the first example that caught my attention. The second one is a Jewish rabbi, an American Jewish rabbi. And his story is he was in his 60s, but a very tall, well-built man, and he was very athletic. He would go to the gym and could lift 300 pounds on a regular basis. But he developed muscular dystrophy. So he sought out the regular treatments and doctors, and they put him on cortisone. And that had a devastating effect on his overall health. He had some serious allergic reactions to being on cortisone for his muscular dystrophy condition. So much so that it depleted his body's ability to produce human growth hormone and testosterone and all the other hormones. There was only one hormone from his pancreas that still could produce, but the others had been killed off. So he had to get all kinds of shots and supplements to keep his human growth hormone and other hormones, alive and well. So he was in a very, very depleted state when he met with Dr. Naram at a clinic, I think somewhere in the US. So after discussing his case, they decided what he needed to do was go to Mumbai, where Dr. Naram's clinic run a 1-month, what they call a Panja Karma treatment. This is basically a 1-month deep detoxifying and cleansing and purifying of your body. And it takes a 1 month, and it involves strict diets, strict herbal remedies, the whole thing. So he decided this is what he needed to do. So this particular American Jewish rabbi, sure enough, went to India, and he brought his human growth hormone with him. Now, it's supposed to be stored in a refrigerator, but whoever took it from him that day at the clinic accidentally put it in the freezer. So it destroyed the human growth hormone. And he's in India, and his doctors are over in California someplace. So he's like scrambling, what do I do? And he spoke to his doctors, and they said, look, there's nothing we can do to help you. Even if we ship you a fresh supply of the human growth hormone, we can't guarantee it'll be in the quality you need it to work for you. So they said, you just gotta push through here, whatever you're doing in Mumbai. So after 1 week on the intense treatments, when he went there, he arrived in a wheelchair. That's how debilitated he was. After 1 week, he was out of the wheelchair. After 3 weeks, his body was self-producing the human growth hormone. And after 1 month, he was ready to go home. And his wife could not believe the person she met at the airport. His hair had grown back. His complexion had cleared. He looked like 20, 30 years younger. She said from when she met him, she could not believe the transformation in him after 1 month at the treatment center in Mumbai. And soon after, at 67, he's back in the gym lifting 200 pounds. Okay, the third example is, 2 women, both of whom wanted to reverse menopause. Now, how many women do you know want to reverse menopause? Well, these 2 women did. One was, she was in her early 50s, and she hadn't had her period in 3 years. And she was struggling with all kinds of severe symptoms as a result of going into menopause, including developing osteoarthritis and all kinds of other issues. I don't remember all of them. But she wanted to reverse the menopause. So she followed his strict diet and home herbal remedies, the whole thing. So at age 56, her full menstrual cycle returned. Now, I don't know if she wanted to do this to have another child. It doesn't say that in the story, but she did get her full menstrual cycle back at age 56. The second woman is from France, and she's just 50, but she had started early menopause 6 years earlier. So she was already 6 years into menopause, and she wanted to reverse it, and she wanted to conceive and have another child. So she sought out Dr. Naram, and she, followed his strict regimen of secrets that he shared with her, remedies, herbal formulas, all of that. And sure enough, her full menstrual cycle came storming back with the vibrancy of what she experienced it in her 20s. And sure enough, she did conceive and had a baby daughter. So those are two women. And the last one is a beautiful story of Clint Rogers' father. And he begins this early in the book, where he's in India and his dad calls him. His dad also was an educator for most of his life. His dad calls him in a very depressed state of mind. And his dad did have a lot of health issues. But when he called Clint, he just said, I really need you to come home. We need to talk. So, and Clint had just started working with Dr. Naram and video recording and documenting everything he saw. He was just in the early stages of doing that. So he did fly home because of the urgency in his father's voice. And we met his dad that particular afternoon. His dad said, look, I'm not sure I'm going to make it to the end of the week. So his dad had, not an old man, just in his 60s. He had a lot of issues. He had heart issues, blood pressure issues, intestinal issues, sleep issues, severe arthritis. He was on 12 different pills a day, and he could not sleep at night, and he's in excruciating pain walking, and he was just at his wit's end. He was seeing 4 different doctors, 4 specialists, who basically said to him, we have done everything we can do for you. So wherever you go from here is in your hands. So Clint shared his stories of meeting Dr. Ram and what he experienced and the people he met with and interviewed, and said, as a last resort, if you're willing, I can take you to one of his clinics. He's coming back to the United States in a few months. We can do this. We can try this. So his father agreed, because his father really was at the point of putting his affairs together. He didn't think he was going to make it much longer. That's how ill he was. So he did meet Dr. Naram at a clinic in California and spent 6 minutes with him. This was like 1 o'clock in the morning. And he came out saying, this doctor has told me more about what I've been experiencing and what I'm struggling with than all of the doctors and specialists I've been seeing for years. And he did that in 6 minutes from reading my pulse. Now, he also did suggest, like the Jewish rabbi, that he come to the clinic in Mumbai to do the 1 month detoxification of his body, the cleansing, the purifying, and all that is involved in that. So his dad did go there, spent a month there, rapidly healed and returned home. And he continued religiously to follow the diet, strict diet and herbal remedies and medicines and what have you. And when he did that, he absolutely made a remarkable recovery. And that was Clint's own father. Came off all 12 medications that he had been on and basically transformed his health. So those are 4 examples of what struck me, from reading the book. Finally, coming into land here just in a few minutes, I'm just going to go over a few key terms that come up in the book to help you understand the philosophy and the terminology behind the Siddha Veda medical approach. When they talk about ancient healing, what they mean is it's not about fighting disease. It's about creating balance in the body, often through purification from toxins through which the body heals itself. That's what they mean by ancient healing. One term they use is atmiyata, and this is a powerful life principle taught by some famous Indian Swami and practiced by members of the Yogi Divine Society. It's basically a value you live by. No matter how someone treats you, you can respond with love and respect. Ayurveda itself is basically the science of life, but it's a medical approach that's over 5,000 years old. And it's a medical science from India that focuses both on our sickness and on what kind of lifestyle helps with prevention of disease in the first place. Deeper healing is a term that comes up a lot. This is just going beyond the surface symptoms to resolve the root cause of a problem on the physical, mental, emotional, and spiritual levels. When they use the word doshas, these are representations in the body of the elements that exist in nature. Kapha, earth, water. The vata is the wind, ether. The pitta is fire. These elements and energies are in our bodies. So when our doshas are in balance, we are healthy. And when they are out of balance, the imbalance creates dis-ease. Ghee that I mentioned earlier, this clarified butter, is a sacred ingredient in India. You can get it here. You can get organic ghee where you cook out the solids from the milk. This is used for cooking, or you can use it for treatment. One chapter in the book, I'll just briefly describe this, is where he met with a young woman, just in her 40s, I think, and was, diagnosing her. And he sensed, maybe from the pulse or whatever he was working with her, he sensed that she had very high blood pressure. And she said, absolutely not. I've never had an issue with high blood pressure, even though her mother had quite a long history of heart disease and high blood pressure and so on. So he said, I need to test you. So he actually tested her in the conventional way for her blood pressure, and it was through the roof in the high 200s, unaware to her. So he treated her on the spot. This is how he did it. He got some ghee on these two fingers and placed it on the crown of her head and sort of rubbed it into the crown of her head. And then he would press 6 times on this center point on the crown of her head. He continued with the ghee and these two fingers, and he rubbed in circular motions on the temples of her forehead for a few minutes, and then 6 times again with the pointing finger into the temples, and then 1 or 2 other parts of her body, ending with the soles of her feet. So he was using the ghee in the circular motions, pushing on certain mamaya points on her body. And when he worked with her for about 30 minutes, not only did he lower her blood pressure, he brought it down to under the normal range. Within 30 minutes, no medication. Ghee, and learning how to use the mamaya points. And mamaya shakti, this is the terminology they use for this particular practice. It's what they say it's an ancient technology of deeper transformation, working on all levels. They consider it an ancient technology for reprogramming yourself to align your life with your true purpose. And it can help remove blocks and rebalance your system. Not only for reducing physical pain or it's also about tapping into what is your life's purpose, what gives you joy and excites you and energizes you. Because if you're not clued into that, or you're already leaning into illness and imbalances in your life. The Panja Karma I mentioned earlier. This is the clinic where you go for the cleansing. It's a multi-process cleansing and rebuilding of the body's core systems. And one of Siddha Vida's 6 keys of deeper healing. So the karma is the action. The panja means 5. So there's 5 different parts to it. 5 actions to remove toxins from or to cleanse your body. Then the pulse healing that I mentioned earlier. It's a method of diagnosis whereby the healer touches the pulse of the patient, and based on the way in which the pulse is jumping, is able to determine what the imbalances and blocks in the body are and how they impact physical, mental, emotional, and spiritual health. And lastly, the Siddha Vida itself is just the healing lineage or school of thought with secrets for deeper healing that go beyond Ayurvedic medicine, but they're taught from master to student. You don't go to school for this particular branch of Ayurvedic medicine. Okay, let me do this because I'm wrapping up. I'm going to show you, let me see how I do this. I'm going to show you some pictures. So I need to do the screen share thing. Let's see if that's going to work for me. Yeah, it will work, but let me find the website I want to show you. Okay, so now let me see if I can screen share. I go back in here, screen share. Let's see. Oh, here it is. Okay, so here we go. did that come up on your screen, Amy? Can you see those pictures, or can you see what's on my screen?
Yes, we can.
Okay, so I'm just going to go through a few. Let's see here. Let's see where I. Oh no, this is blocking. So, one second here. How am I going to do this? Oh, let me move this. There you go. Okay, so this is Dr. Clint G. Rogers. This is when the book first came out, and I think he reprinted it because here's the thing, Dr. Naram actually died last year. And yet this book only came out, it came out a few months before he died, but it's a reprint because he's here promoting the book himself in these pictures. So the second one is of, I don't know who that person is. Let's go to some more. This is with, I don't know who this is, a biologist person, different people who endorsed the book. I think Deepak Chopra is in this picture and another Indian practitioner. And the person on the left is Dr. Clint G. Rogers. He was a big hit in Italy. I mean, they almost erected a statue to him in Italy. He went there for years running clinics. So he's gotten all kinds of awards in Italy from mayors and doctors. Here's the Dalai Lama blessing the book after being treated himself. Other Rinpoches and well-known people in India also blessing and endorsing his book. I think this person in the left picture with Dr. Naram, Dr. Naram is in the white. He always wore a white suit of some kind. This is his teacher, who apparently is well over 100 years old. Nobody really knows. This is the teacher under which he served a 2-year apprenticeship. And then another holiness from India. And it goes on, and then there's different awards. And then you have people from here in the United States, doctors and entrepreneurs who also endorsed his work. So let me come out of that. Let me see where how do I stop my screen? Okay, stop screen share. Okay, and a final note from my notes. This is a German doctor that Clint Rogers interviewed when he was trying to go deeper into what were other medical doctors and medical professors' take on complementary medicine. So he met with a doctor who struggled for many years himself with a stomach issue that he couldn't get effective treatment for. And he's a medical professor at some university and tried everything, but nothing was providing lasting relief from whatever particular stomach issue he had going on. So he found himself an alternative complementary medicine practitioner who treated him and treated him successfully. This got this particular German doctor interested in complementary medicine, and he took off for a few years researching all kinds of traditional alternative healing modalities around the world. And this is what he said to Clint Rogers. He said, I realized that in modern Western medicine, we make everything into a fight. We fight disease, we fight bacteria, we fight cancer. In the Eastern system and in other ancient traditions, it's not about fighting, but rather creating balance through purification. Great healers of these ancient traditions are adept at identifying imbalances and prescribing remedies to cleanse and rebalance the system. And now my own final word on it is, in the final analysis, the Eastern philosophical approach to health and healing is not what is wrong with you, but rather what is well within you. How can what is healthy and balanced in your mind, body, and spirit support your healing, recovery, and ultimate flourishing? Sorry, I went on for a little long on that, but there you go. That's end of my story.